All right, we are live. Welcome, everyone. Excited to be here with you, Dr. Ovadia, Dr. Philip Ovadia here, and we wanted to have a discussion today about the Make America Healthy Again movement. And I have joining me Lisa Simmons, who is the nurse practitioner at our practice, Ovadia Heart Health. So welcome, Lisa. Great to have you here.
Glad to be here.
Um, Before we get started, just a couple of housekeeping items. First of all, a typical medical disclaimer in this forum. We are not giving anyone specific medical advice. And if based on some of the things we talk about, you might want to make changes to your medical regimen, you should definitely check with your healthcare practitioner first. One of the things we're going to talk about is if you're looking for a healthcare practitioner that understands metabolic health and might help you implement some of the things we talk about, that our practice provides telemedicine care across the United States. And so we'll talk about how that might be an option for you if you're interested in it. Before we get into kind of, how Lisa and I put metabolic health into practice, I really want to just talk about, some of the exciting developments recently around the Make America Healthy Again movement. And, to me, this really transcends politics. And is something that I'm very excited to just see health really entering the national conversation. So, Lisa, what are some of your thoughts on some of the things that we've seen over the past few months? Robert Kennedy initially, made this really an important part of his platform when he was still a candidate for president. And then, of course, decided to sort of join the Trump team. And now, since the election, is being, has been nominated, I guess, officially for a high role to be able to influence our health policy. So, what are some of your thoughts around that, Lisa?
My thoughts are I'm excited about it just for the fact that being in healthcare and having been in it for almost 30 years and just kind of seeing the trajectory of where it's gotten away from really taking care of the patients to really treating more of numbers. And, going along that line, I really want to get back to the basics. And that's what I was taught in school many years ago. And that's kind of what I want to get back to is really taking care of people as individuals and not lumping them into just one category of this or that. And really, and educating. I think we've gotten away from the educational part and teaching people how they can do things for themselves to make themselves healthy.
Yeah, very much so. I mean, you and I are around the same age, and we both remember a focus on health in school, right? I think both of us were in school at the time that you had the sort of presidential. Forget exactly what it was called, but like the presidential fitness program or a medal or something that you could get. And I think that aspect of health was still very much emphasized, and unfortunately, that has been de-emphasized. And one of the things that I think we both struggle with most is the mainstream medical kind of belief that getting sick is inevitable, right? Because almost everyone is sick. I think, unfortunately, a lot of doctors, a lot of practitioners of all sorts, have sort of lost the concept that we can keep people from being sick, right? We've gotten very focused on taking care of sick people, and we don't really think about in mainstream medicine keeping people from being sick. We don't think about making people healthy again, right? And so it is very exciting to see that. You and I both, have very much been in the mainstream medical system. You have a background in critical care, nursing, and talk a little bit about maybe what you saw and what you experienced then versus what we do in our practice now, trying to reverse and prevent these chronic diseases.
So when I first started as a nurse back in 1995, I used to see hardly patients weren't really on medications. I mean, if they had surgery, they would be on medication for, just for a short period of time to get off of that, but they were on very minimal amount of medications. And when I, as the bedside, as a nurse, I was actually expected to, take care of the patient. We used to give back rubs and, things like that to the little old ladies. And as time went on, we got away from that. And then when I was actually working in the ICU, even as a bedside nurse, and then eventually I was working as a nurse practitioner in that sense. But what happened is I ended up being just a med nurse is pretty much it. I got away from really taking care of the patient. It was, they have a medication at 8 a.m., at 10 a.m., at 12 p.m. And it literally, I felt like my whole day was just giving them medications all day long. So it had really changed the way that I saw healthcare being delivered. And, being what I feel honestly as a patient advocate, as a nurse, I just felt like I wasn't even listened to anymore when I would say something was going on with a patient. And I just felt like I was even blown off. And it was really sad to me because that's not what I went into healthcare to do in the first place.
Yeah, definitely so. And, I unfortunately continue to see it on a daily basis, still being a practicing heart surgeon. It's what I see every day. Sue Monroe, great comment that she's hoping this brings more awareness to our lifestyle and that more physicians will accept metabolic health. And that's very much the mission that we're on. When I established this telemedicine practice, Ovadia Heart Health, 4 years ago, it was lonely out there, right? There weren't many physicians that were putting this into practice. And that's one of the things that drove me to do it. I had gotten such great benefit myself. I had, really started working with friends, family, and seeing the benefits that they had. And I knew that I needed to do this as a physician. Honestly, I could have continued. I have a very good and successful career as a heart surgeon, but I just found that wasn't enough anymore. I am always blessed that I am able to help people in that way, but I recognize that I can even better help people by keeping them off the operating table. And that's what we've been aiming to do here in Ovadia Heart Health, in the practice for, it's now hard to believe this, but we're coming up on 4 years that we've been at this. And, in order to do that, I recognized that, I needed a great team. And that's why I brought Lisa on board as a nurse practitioner. We just got a comment I see on YouTube from Krishna Hanks, one of our amazing health coaches. She's saying, as a longtime health and wellness professional, the Maha movement brings a much welcome energy and excitement. And Krishna has been doing this for quite some time. She's very experienced. And she is one of 3 health coaches that we have in the practice now. Besides Krishna, Jen is another one of our health coaches who has a background working as a certified diabetic nurse educator, works in a diabetes clinic. And again, similar to my experience, right? Loves helping people manage their diabetes, but would much rather be reversing and preventing it. and that's why she joined the team with us. And most recently, Chris Cornell, who's in the background here, helping us run this live stream, has joined us as a coach as well. And many people in the low carb community are already familiar with Chris. He's really been active getting this message out there on social media and working with organizations like Low Carb USA and the Society of Metabolic Health Practitioners, and very excited to have him to help us expand the team. I'll mention, that if anyone watching this is interested in joining the practice, you can go to ifixhearts.com/talk, or just go to ifixhearts.com, hit the talk with our team button, and you can set up a call with our team to talk about the ways that we work with patients. And we do have lots of different options depending on what kind of care you're looking for, as how we can work with you. Another comment coming in from Cherish, who is our amazing practice manager, Cherishing Your Health there on YouTube, and certainly agree that we have the best team for sure. I am honored and blessed, right, to be working with the team that I have, and to have brought together all of these people that are really passionate about metabolic health. Maybe Lisa, you can talk about your experiences in the practice, some of the things that you've seen, and some of the ways that we work with people to help them focus on getting healthy again. We very much have been on this mission of making America healthy again, sort of one patient at a time, and talk about some of the ways that we work with patients in the practice.
Well, I think the biggest thing is we reassure people that what they're doing is the right thing. So, the comprehensive labs that we get, really no other doctors really look at that. So, because we know that the basis to chronic disease is inflammation and insulin resistance. So, and also too, most of the patients that come to us have already started. They just want to be reassured that, doing carnivore or, eating whole foods isn't going to kill them. Right. And so it's nice to be able to reassure people, but also to educate at the same time. And I think it's very eye-opening when we start talking about the quality of their cholesterol as opposed to the number, and, getting back down to the basics. And, a lot of people don't even know that they can fix a lot of it. I mean, they can through diet, but then when I do lab reviews, people should walk away with a comprehensive review where I'm actually pulling in a lot of information. I want to hear about what's going on with them, what they're doing. And then they can walk away with, if anything is off, with a plan, with a plan of action that they can do. And then, talk about rechecking labs, because again, in our practice, we don't check labs just once a year, right? That snapshot in time. We do labs every 3 months. If you're doing things to make changes in your metabolic health, we want to see and make sure that those changes are actually working. And if there's something else, another path that we need to go down. And that's what's great about our practice too. Of course, we have Dr. Ovadia, who's great at himself, but we have such a great team. Everybody works well together, and they are truly passionate about helping people, which is at the core for everybody. And all of our health coaches are exceptional at really looking at other things, because it's not just nutrition. It's not just exercise. How are you dealing with your stress? Are you sleeping well? And looking at all of the aspects of lifestyle.
Yeah, definitely. So, I intentionally have created this practice to be very different, right? Mainstream medicine has a lot of problems in it. And I wanted to try and fix as many of those problems as possible in the way that we interact with patients. So for instance, when you sign up for a consult visit with our practice, that's not just a one-time consult that you're going to see me. You see and you engage with the entire team. You are going to do coaching visits with one of the coaches. You're going to have pre-consult review with Lisa, and then you're going to have the consult with me. And one of the things that we do during that time, that lead up time, is we make sure that you've had the appropriate testing that goes well beyond, the average lab panel that your doctor may have done. We're going to, if appropriate for you, get things like a coronary artery calcium scan. We really do want to get a comprehensive picture of your health, your metabolic health. And we want to then, through that consult, empower you to improve your health and prevent and reverse these chronic diseases that we're all so concerned about. Things like heart disease, diabetes, Alzheimer's, autoimmune disorders. These are all things that we address through the practice. It's not just heart health, although heart health, obviously, because of my background, is a main focus of ours. As Krishna said here, it's really a team-based approach to optimizing your metabolic health, and not just the old school way of just managing a disease. Of course, the business people behind the scenes continue to, pull their hair out, right? Because I always say that our goal is for you not to need us, right? Just like the book is called Stay Off My Operating Table, when you join our practice, or when you engage with the practice, our goal really is that you don't need us. You're healthy again. Now, with that being said, most people continue to remain in the practice and remain engaged with the practice because it is such a different approach, and they find it so valuable. But sometimes all it is just a one-time, or I shouldn't say a one-time. Like I said, it's actually within that initial consult, there's actually multiple engagements with all the members of the team. So it really, I'm always amazed because at this point, to be transparent, right, we have a waiting list. If you call and you sign up today, your appointment with me probably isn't going to happen till February or March at this point. We have, a lot of demand. But by the time you get to that appointment, it is now almost assured, right, that your health will have noticeably improved from the time you make the call today to join our practice until you actually see me for your consult. I'm amazed at just the improvement that people get from working with the coaches, working with Lisa. And that's really been a rewarding part of the practice, and something the patients are surprised by as well, right? Because most people are used to, okay, we're unfortunately, again, we're all used to waiting to see the doctors because there is such a demand on doctors' times these days. But typically when you're waiting to see other doctors, nothing's happening, and you're certainly not getting any better, and you hope you're not getting worse. But in our practice, you can be almost guaranteed that as long as you're engaged with the process, you're going to be better before you even see me. And that's just been amazing to see. So again, if anyone's interested in exploring that, in joining the practice, ifixhearts.com/talk, and you can set up a call with our team. So before we wrap up here, Lisa, let's give our version of Make America Healthy. And, if we get the call from RFK, what our advice would be as to some high level things that people can be doing to make themselves healthy again, and therefore make America healthy again. What would you say your top tip would be for people that don't want to wait for the government to do this for them? They want to get started on making themselves healthy again today.
Do I have to say just one? But actually,
you can give a couple, yeah.
Because one is really hard to stick with. So I would have to say my biggest ones is really getting the ultra processed foods out of the pantry. You don't have to eat it to get rid of it. I would throw it out because it's junk food. And then getting back to whole foods. If it has one ingredient, you can eat it with the focus on protein and fat. And then my other thing is read labels. Seed oils are everywhere and they are so inflammatory to the body. I'm really on my soapbox about this right now, because every time I go to the store and I turn around a label, when you think something's going to be healthy and it says 0 sugar, and you turn it around and it's got soybean oil or canola oil or vegetable oil in it, it's very frustrating. And it's definitely educational pieces that we're trying to get out there to help people get themselves healthy.
Love it. Love it. And, my biggest piece of advice, actually, before I give that, Krishna dropped her advice in the chat, and that is control your food equals controlling your health. And very much true. I think our health starts with what we eat. Yes, there are other factors that go into it, but what we eat is the most important factor when it comes to our health. And what we've been eating is what has gotten us in this situation that, the vast majority of us are unhealthy. But the good news is that the way to fix it is what caused the problem in the first place. And just paying attention to what we eat is the number one factor when it comes to our health. And, before we wrap up, my biggest piece of advice to people out there would be, don't wait, right? You don't have to wait for the government to do it for you. We're all very excited. I hope that Robert Kennedy and the team are able to do what they are setting out to do. But you, the individual watching this, and if you're watching it live or you're watching a recording of this, don't wait. You take charge of your health now, and you make yourself healthy again, and then we can worry about the rest of America. So we're here for you, and there are lots of other great metabolic health practitioners out there. Please find them, seek them out. Don't be passive about this. Too many people just sit back and they're waiting for their doctor to do this for them. They're waiting for their doctor to change. You change your doctor, right? You change the way that you get healthcare and you interact with healthcare, and you take control of your health. That, I think, is the most important thing. So thank you to everyone who took the time out to join us. Thank you, Lisa, for helping and educating people today. And one more time, it should be there on the screen for you. If you want to work with our team, ifixhearts.com/talk. And we've been doing these live streams a couple of times a week now, different members of the team. So it's a great way to meet everyone and be on the lookout for them. If you're not already following us here on YouTube, please subscribe to the channel so you get notified. If you're on LinkedIn or Instagram or X, just follow us there and set up so you can get notifications of when these live streams are happening. So thank you, everyone. Have a great rest of your day, and go out there and make yourself healthy again.